Welcome everyone to our talk to Prof Leith today. I'm Leonie from Run for Rhinos, and then we have Sean, Jamie, Andrew, and Jacob joining us. We are very excited to talk to you, Prof, and we hope that you will enjoy it as much as we are. So, Prof,
Great.
thank you. So, Prof, you've been in this industry for quite a while, and you've written a lot of research papers and done quite a few hours in field work. I would like to know what sparked your interest in going into this program, in this course.
Okay. Yeah, I mean, so just to start off with, obviously, rhinos are very special to me, like they are, I think, to many of us in South Africa and around the world. And I've always been very interested since being an undergraduate student, knowing a bit more about rhinos. They're quite fascinating creatures. It's obviously a very special animal to work with just because of their sheer size. And already when we were undergraduates, we learned how difficult it was to work with them. So that was kind of the beginning part that sparked my interest. And then when I started working as a researcher mainly, we had lots of discussions with people from St. Parks, the vets that work down there, and they obviously said how difficult things were. And we had a number of discussions about animals being lost under anesthesia. So it really sparked my interest in terms of how to improve things and how to look at ways of actually making it safer to anesthetize these animals. So that's where it all started.
How long have you been doing the research and getting involved in all of the pharmacology parts?
So specifically with rhino, we started about 10 years ago with the various different research projects that we've been doing. But from a point of view of doing pharmacology research specifically related to wildlife, I started that probably about 15 years ago. So it's been quite a while that I've been involved in this field.
And so, Prof, I'm sure that your research is very broad, but can you maybe tell us about what some of the most interesting points are in your research and what interests you in particular?
Yeah, so probably the biggest focus of my research, or the biggest interest of my research, is specifically looking at ways of trying to improve the safety of both the anesthesia, so mobilization of wildlife, but also some of the other veterinary management procedures like other capture, translocation. So, and the important part there is to try and have a look at it from a physiological point of view, to understand what's happening in the animals, and then looking at novel ways of improving that, so reducing the stresses that occur. And often the exciting stuff is when we find new drugs that can be used, and if we test those and we see how they actually do change things and how they do improve the safety. So that's, for me, probably the greatest interest that I have, particularly in this field.
Sorry, Prof. May I ask, how long does, if you find out a drug has a certain effect, how long does it take for that drug to actually be put into use, or the research to be confirmed and to be used, obviously, in the field?
Yeah, so it does take a long time. We try and use drugs that are existing already or registered already for either human or animal use. And that obviously makes it a little bit quicker, because then people can use those drugs extra labelly or off label. However, if it's a new drug, it takes a long time, and the projects in their own right, they take quite a bit of time. Particularly if it's a very new scientific drug, you've got to, nothing about the drug, you've got to work out drug doses, you've got to confirm that there's some kind of safety, and then you can only test to see whether the drug works. But then there's all kinds of other registration requirements, so it can take many, many years to get a new drug registered for use. So that's a very long process, but that's why we try and look at drugs that are already registered and just use them for a different purpose in wildlife.
So,
No, go ahead, Andrew.
I was thinking, with the variety of drugs that are used in wildlife mobilization, can you just talk a bit about the different approaches that can be taken towards rhino immobilization throughout
Okay.
different vets and different approaches that could be approached.
Yeah, so I guess the important part is to understand what you're trying to achieve. So if you're working with rhinos in the field, you've got to try and knock that animal down as quickly as possible. You don't want an animal running too far or running over a cliff or stressing too much. And there, the main focus is to use etolfine. So M99 is the drug mainly used, particularly in both white and black rhino. Sometimes some of the vets will add thiofentanil to that. So you use half thiofentanil, half etolfine, and that sometimes knocks the animals down a bit quicker. However, both of the drugs do have quite severe side effects. If you're working in a zoo situation or in a captive situation, there are other drugs that can be used. However, the potent opioids, thiofentanil and etolfine, are still the main drugs that are used, even in zoo situations. But some zoos in the world, in other parts of the world, they don't have access to those drugs. So then they use other combinations with butorphanol, azapro, medetomidine. Sometimes they even add ketamine or midazolam into those combinations. So it really depends on what circumstance and what you've got available.
Okay. I'm sure it's a very fine balancing act, and many considerations to be taken into consideration.
Yeah, definitely. I mean, as I mentioned, both the potent opioids, thiofentanil and etolfine, have severe effects on rhino, particularly thiofentanil. But even etolfine causes severe side effects, and those can put an animal at massive risk. And so the important parts and the things that we've learned really is that as soon as an animal is immobilized, you do need to get to it as quickly as possible and to administer butorphanol to the animal. And that butorphanol, what it does is it just partially reverses some of the effects of etolfine, and it allows the oxygen levels to build up a little bit higher in the animal's blood. And as soon as you've given that butorphanol, then the next best step is to introduce oxygen. So we administer oxygen via a nasal tube, and then that can usually that brings oxygen levels back up to normal. So that is one of the key things that people in the field should use, is both butorphanol and oxygen. Yeah, I think there are a whole bunch of other things that can be done that are important during immobilization. Obviously, positioning animals, all of those things can really have quite an important effect on the animal. So you don't want the animal lying downhill. You want to have it lying with its head up, up a slope. You ideally, if you can, put them in sternal recumbency. But if the animal's going to be in one position for a long time, it's actually better to roll the animal onto its side, or roll it from its side onto its chest, then onto the other side. So there are a lot of those things to consider, and it really depends on the circumstance that you're working with the animal under.
Prof, is there any difference in the way the black and the white rhino handle the drugs?
Yeah, there are definite differences. The black rhino don't appear to be as sensitive to the side effects of the potent opioids. So they seem to handle the side effects a lot better, or they don't get a severe hypoxia and severe hypercapnia and acidosis. But white rhinos seem to be a lot more sensitive to those side effects. Obviously, there's a difference in the size. The bigger the animal, the more complicated it becomes as well, particularly more stress on the physiological system. So a white rhino is quite a bit bigger than a black rhino. And that also obviously makes the white rhino anesthesia a lot more risky than a black rhino. However, black rhino do actually still suffer quite a lot from the side effects and do develop quite severe hypoxia and hypercapnia especially when the potent opioids are used in them.
Are there any ways that you can actually lighten the side effects or the effect the translocation have on these species?
Yeah, so there are a number of ways. Obviously, from a drug point of view, we've already spoken about butorphanol. There are other drugs that could be considered to be used in terms of reducing the side effects of the immobilization or the side effects of atrophy. However, a lot of those still need to be tested in rhino. But from a perspective and stress response, because obviously any capture event or translocation event will cause quite a severe stress response, you then can look at other drugs, particularly the tranquilizing drugs or sedative drugs like midazolam, or tranquilizing drugs like azaparone, haloperidol, zuclopenthixol. Those drugs are sometimes used as well, particularly zuclopenthixol for translocations and azaparone also for translocations. Those are drugs that seem to work pretty well at reducing the stress response in these animals.
Hi, Prof. Sorry, how does one go about differentiating the dosage of drugs with obviously unknown weights of rhinos in the wild, and how does one compensate for obviously under or overdose?
Yeah, so that's something that comes with experience, yeah, it's not always easy for a new graduate vet to get a feel for the size of an animal. Often you dart in an animal from a helicopter, and it's sometimes a little bit of a challenge to estimate the size. Obviously, if you give too much of the drug, it's going to cause quite severe depression, respiratory depression in particular. But yeah, so it is a bit of a challenge, and fortunately there is a bit of a safety margin, and if you do overdose the animal a little bit too much, the key thing is then just to get to the animal as quickly as possible so you can give additional butorphanol.
Prof, a rhino can weigh a few tons. How do you go about getting them into a crate?
Yeah, that's an interesting question, but again, the drug butorphanol, and there are other drugs that have been used like nalbuphine, but specifically butorphanol is very useful. So you give the animal a bit of the butorphanol. It basically causes lightening of the mobilization, and once the full effects of the butorphanol kick in, you can then stimulate the animal. Usually we use a cattle prodder to give them a small shock, and that then gets them awake a little bit more, and then you can get them on their feet by doing that. But however, before you do that, you've got to put ropes around their horn, and sometimes you even need to have some ropes behind them, and then you can actually guide the animal. You've got to have quite a few people to do it because obviously they're quite strong. And you can then guide them by using those ropes, guide them to walk into a crate. So it's quite impressive when you see it done, and guys that know how to do it, it's quite impressive to watch them because they can do it so efficiently, and it looks like it's actually quite easy to do. But it is a very tricky technique, and you've got to know what you're doing, and you've got to have a good team to work with.
Practice makes perfect.
Exactly, yeah.
Prof, how do you keep animals calm during long journeys of a few hundred kilometers? How would you go about that during the transport?
Yeah, so again, we rely a lot on the tranquilizing drugs, particularly zuclopenthixol acetate, and also azaparone. So sort of current practice, not everyone does the same thing, but it seems like the current sort of practice is as you've at the time that you've dart the animal, you give them zuclopenthixol, and usually you have azaparone in the dart, and then you load the animals. And during the transport, you keep monitoring the animals, particularly if you can feel the animals moving in a transport crate. You would then stop the transport, and then you might give a top-up dose of azaparone just to keep the animals calm. So essentially, most of what you use are these drugs to calm the animals. But the other things that are also important, one of them is also to ensure that there's good ventilation in the crates, which then controls the temperature in the crate, that the animal doesn't overheat or get too cold. So that's important. And then the other thing is also just the way the person drives a vehicle. So you've got to drive in a way that's not too bumpy for the animal. You don't suddenly brake. And often what the guys also recommend that do the transport is that you try not to stop too often, that you actually keep driving, because that seems to calm the animals. And then some of the other things that they've been trying, particularly in black rhino, because black rhino stress quite a lot more than white rhino when they're in crates, is to blindfold them, put earplugs in them, and that seems to keep them calm as well. They don't fight with the crate as much when they've got a blindfold or earplugs in.
And so, Prof, can you talk more about sort of additional stressing situations that are a bit more complicated? For example, rhinos with pregnancies, or after some sort of stressful poaching incident. With these additional complications, what are some of the approaches you might think about?
Okay. Yeah, I mean, so pregnant animals, it's a bit of a challenge. So ideally, one shouldn't transport a pregnant animal, particularly a very pregnant animal. It's not easy to always determine whether an animal is pregnant or not, particularly obviously if they're early pregnant, you won't be able to see that. It's very difficult to do a pregnancy diagnosis. But obviously if they're very far pregnant, then you ideally wouldn't actually translocate those animals. An animal that's injured from, say, a poaching incident, that can also be a massive challenge. And the important part there is if you really have to move an animal from a property where it has been poached and it is injured, you need to ensure before you load that animal that you've actually stabilized the animal. Often they are dehydrated, they might have lost a lot of blood, they might have an infection, a fever, and ideally you want to try and stabilize them before you do any translocation. So you might have to dart the animal, treat it, give it fluids, leave it for a day or two, then go back, dart it again, maybe do further treatments, give more fluids, and then only load that animal. So you've got to be very careful that you don't load an animal that's compromised, because definitely that stress of the translocation will push the animal over the edge.
Thank you, Prof.
Okay.
Prof, when you anesthetize a rhino to do a surgery, maybe like when they are under for 1 or 2 hours, how do you approach that? Because they are sensitive to the drugs, to keep them calm and safe during the procedure.
Yeah, and I mean, that's very important, particularly with large animals. There's a lot of things that you should consider, especially if they're going to be under anesthetic for a long time. So it's quite essential with animals that are going to be anesthetized for so long that you definitely provide oxygen, obviously butorphanol right in the beginning. The other important aspect there is that you might need to consider giving fluids in a drip over that time, but also to move the animals. So you can't leave an animal lying in one position for a very long time because you're going to get reperfusion injuries. So it's important to move the animal, either to move it onto its chest if it was on its side, or from one side to the other side. All of those things need to be considered. For longer anesthetics as well, usually the drugs, particularly atropine, after an hour it starts wearing off. So you might need to consider using other anesthetic drugs or give top-up drugs. So there's quite a lot of things that need to be considered. If the animal is lying on a very hard surface, you might want to consider trying to put cushions underneath certain bony parts of the animal. It really depends on how and what procedure you are going to do. But yeah, it is a challenge, and one's got to be very careful, and one's got to try and work as quickly as you can when you're doing those surgeries. But if it's going to take time, you need to implement some of those steps.
Prof, I would like to say thank you so much for taking the time and doing the interview with us. And we really do appreciate it.